enter, they have to wipe their feet on a disinfectant mat. They have to put their hydroalcoholic gel on their hands. Then they are taken to the table, and there is a distance of at least 1.5 meters between each table. But I always try to do more. We have an extra job. We are police officers, unfortunately, because people are not used to going out. As soon as they come in, they think they will take off the mask when the goal is to keep it on during their trip. Even when they go to the washroom, they are obliged to put the mask on, and they should avoid moving around as much as possible. And to a story that's also top of mind in the African continent, Mali's new military junta has said it will put in place a transitional government as its West African neighbors said they would dispatch envoys to help secure the immediate return of constitutional order and called for its ousted president to be restored to office. Rebel soldiers seized power Tuesday, detaining President Ibrahim Boubacar Keita, Prime Minister Bobu Cisse and other officials in a fresh setback for a country battling chronic instability and a jihadist revolt. The coup is Mali's second in 8 years. And to something that gives us focus on our conversation of the day, millions have died needlessly from AIDS-related causes due to lack of access to existing therapies, according to the UN AIDS chief, who has called for a fairer approach to tackling the coronavirus pandemic.
We also see in our report that the coronavirus, we were already off track. We were not on track to reach. We have 1.7 million new infections. We were supposed to be at 500,000. We have 690,000 deaths worldwide. We're supposed to be at 500,000. So we're already off track. But coronavirus is threatening to blow us even more off track. We are getting reports of facilities being closed, supply chains being disrupted, borders closing, lockdown measures hurting the most vulnerable and stopping them from reaching services. So we've done some studies and we have alerted the world that if disruptions of this kind continue for another 6 months, you could have 500,000 additional AIDS-related deaths in Africa alone.
Well, that is the focus of our conversation today, those living with HIV and how that has looked like for them during this pandemic. And of course, we'll also look at the strides we've made as a country since the first case of HIV was reported in this country back in 1984. But before we get to that, let's introduce those that are joining us on this very vital conversation. We have Dr. Catherine Ngoge, who is the head of NASCOP, and that's the National AIDS Control Program. We're also joined by Nelson Otuoma, who is the CEO, Network of People Living with HIV in Kenya, NEFIC. We are also joined virtually by Doreen Mora Mochache, who is living with HIV or positively with HIV, and she really is a loud HIV advocate. We're also joined by Victor Keruki, also living positively with HIV and also a HIV advocate. Thank you all for joining us. Now, I'll start off with you, Dr. We are living at a time where things have been disrupted by the pandemic. How is the situation for those living with HIV?
Thank you so much for your question, and good morning.
Good morning.
We're doing well. So far, so good. We are continuing. Our services are still continuing at the health facilities. So when you look at in terms of HIV testing, there was a bit of a decline in March and April, but now we are a bit stable. In terms of treatment, we still have commodities in within the country, and at least our clients are able still to access the drugs that they need. So we are stable. We are doing well.
Okay, yes. And we would want to understand, for those who don't know this, why is it that they say those living with HIV are more susceptible to severe form of COVID-19?
Okay, thank you for your question. It's more of, when COVID-19 came, all we know is that anyone who had any underlying condition was more susceptible to, acquiring that because of the immune system. And is it either diabetes or hypertension or HIV virus, any pre-existing condition, you are susceptible to getting to acquiring COVID-19. But the ones who are HIV positive, the ones, for example, the ones who already know their status, if they're on treatment, we have, like, for example, adults, around 96% their virus suppressed. So at least their immune is not bad. I'll be more worried the ones who do not know their status, so that means that their virus is very high, or the ones who are not on the optimized regimens. That means that they have not suppressed their virus. That means that their CD4 rate is not at least high; it's a bit low. Those are the ones I'll be worried about. And in the data that we have had so far in the country, for the clients who have, for the patients who have died of COVID-19, the initial data we had only 4% of those who had died were living with HIV. Yes.
Okay. And Dr. Otoma, or Nelson Otoma, for purposes of this conversation, there definitely are more challenges that those living with HIV are facing during this pandemic. What are some of those?
Boss, Fisa.
Nelson, I think he's not hearing me, but we'll get back to you in a moment. Let's bring in Doreen. Doreen, you are one of the people wearing these shoes, so you know how it pinches. What are the challenges during this pandemic?
Some of the challenges during this pandemic are the issue of nutrition, because you find a lot of people are struggling to get a meal on their table, especially since COVID started. A lot of people tended to lose their jobs. So you find people are struggling. You have to choose, do I take medication on an empty stomach, or I just skip today and then hope for a better day tomorrow? And then you're not very sure how tomorrow, if tomorrow is even going to be a better day. And I have gotten a lot of messages, people telling me, is there a way we can get help? I have directed some people to places where they can get help, but still there is that gap, because you also can't reach out to everybody. And during the cessation of movement, there was an issue with access to treatment, because maybe some people found themselves in places that had been locked down, and they could not access their medication because it's their treatment day or their day to go for the clinic, but they're not able to access medication because they're in an area that is not normally their area. So those have been part of the challenges that we have had to go through. And also there is the issue of accidental disclosure, where maybe you're living with your partner and at some point they don't know that you're living with HIV, and then they happen to see your medication or come across your medication. And that has caused, I have dealt with around 2 cases around that, and trying to tell people, just calm down, try to understand your partner, where they're coming from. But sometimes it needs a form of intervention where you're there, because this person does not understand why you have been on medication and you're not telling them that you're on medication. So they have to come to terms with that. And the person whose medication was found also finds themselves in a position where they're not able to explain why they have not been, they have never been open about their status. So it's been a little bit tough, especially during this time. And then there is the issue of now mental health. You're living with people who don't know about your status. They keep on making stigmatizing jokes about HIV here and there. And you can't, you're just trying to cope with these people, but you can't. And probably normally you're not with them. Especially this was a case that I actually addressed from a university student who is most of the time in school in Nairobi. Now, when schools were closed and they had to go back home, and now people are there saying, watu ukimwi wanakuanga sijui aje. That thing of keeping calling people watu ukimwi got to her until at some point she was like, I'm going to stop taking this medication. And I told her, you're not taking this medication because of your friends and relatives. You're taking them because you need to live a longer life. And yeah.
Okay, now we'll talk more about the stigma and, of course, some of those challenges that face those living with HIV. Victor, you also are living this reality from a man's point of view. What has been the most or the biggest challenge for you during this time?
Thank you so much. Some of the challenges I can't speak for me personally, but for young people living with HIV, it's been, these are tough times. And most young people living with HIV who are in relationships, there's been a rise of gender-based violence, and because a person is forced to like cohabit with their partner, with the other partner, and which most of the time you find that the person living with HIV has not disclosed their status to this other to their partner, and it gets really, really, really hard for them to like take their medication, because probably if you're taking your medication at 10 p.m., probably your other person is there, and it becomes a challenge. So the challenges that right now we can say it's the cohabiting and probably the rise of people not adhering to their medication.
Okay, now I'll start off with you, Victor. When were you diagnosed with HIV?
I was diagnosed 2003. I was 10 years of age. We're actually turning 18 next year.
Oh, wow, it's been 18 years. So from your background, is it that you were born with HIV or did you contract it along the way? Do you know?
As far as I know, I was born with HIV because my mom passed on when I was 7 years old, and years later, that's when I started being sickly time to time, and I was told that I was HIV positive in weirdest manner of all, because if you can remember back in the days, it was pretty hard. There was lack of information, and how the doctor disclosed it, he used a chart. So the chart had a skinny person and one, you can say healthy person, because alikuwa ameunga kidogo. And so the doctor said that this person whose skin is person who has HIV, and they used to call it ukimwi, and ukimwi is a very, very big word. And he said that sasa huyu ni wewe uko hapa, and you live kumeza dawa for the rest of your life. For a 10-year-old, it was too much. Yeah.
Okay, and at that point, did you find out at that point that your mom had passed away from the same?
No. I didn't find out until I think 3 years ago, when I was trying to apply for a passport, and I had to like get her death certificate. So that's when I got hold of the medical file that had everything. That's when I came to know that, yeah, my mom also passed on to HIV, sorry.
And let me go back to Doreen. How long ago were you diagnosed with HIV?
My official diagnosis was done 20 years ago, but I was born with HIV. I've lived with it for 28 years now. And when I was 8 years old, I had an infection called herpes zoster that was on my left side of the face. And that is when my parents took me to Kenyatta National Hospital, and I got to be tested, and they were told that your daughter has HIV, and she's going to have to live with it for as long as God allows. But according to the doctor's projection, it was I was given up to my 12th birthday. So they were like, if she survives up to 12 years, then she's going to be okay. If not, then you just leave it to God. So my parents knew very well that I was going to die. So after I was discharged from the hospital, they had me baptized, prepared to go to heaven. And then later on, 5 years later, when I was 13, my mom got sick, very, very ill. That is now when she got tested. All along, she was in denial because they knew I had HIV. They had been told by the doctors, go and get tested. But for my mom, she was totally in denial. My dad got tested. He was HIV negative. My mom refused to get tested. So when she fell ill, she got tested. She turned out positive. And a lot of people did not think that she was going to make it. Then she made it. And now when she woke up, she was like, now let's go to hospital. There is something that the doctors need to tell you. So she took me to Kericho level 5. I was tested. just like going to hospital for me was like a norm. So it did not look like like an abnormal day. So the doctor told me, Doreen, you're living with HIV, you got it from your mom, and you will have to take some sort of new medication for the rest of your life, and they're called ARVs. So for me, at that moment, it did not hit me that HIV was a bad thing. Because all along, my parents kept telling me, you have skin cancer, you have a heart problem. So when they told me I have HIV, I was like, okay, so that is now the new one. Okay. So I was given ARVs to start, because all along I was on Septrins. And then I was told, now you'll have to take this medication every day according to the time. Even the time was written on on the containers of my tablets. So I didn't take it as a bad thing. In fact, for me, I took it as a very nice thing, because my mom will take me to hospital every month, so I'll have to miss school. And then after hospital, she'll buy me chips, kuku, and soda. So those things made me happy. So at that moment, it did not hit me like it was a bad thing.
Okay. Now, the reason why I needed to understand the background for both Victor and Doreen is because even today, access to hospital has been very challenging for some people, which now goes to deter the rate of testing and diagnosis. How does that look like as we speak?
Thank you, Gladys. Definitely, the HIV testing was affected, especially, as I've said, between March and April, but things have been stable. However, when you look at the data between March and April, we have had that 1% reduction of HIV testing, both at the facilities and the communities. But the one which has been affected more is within the community testing, which has reduced with almost 71%, because amidst of the travel restrictions and meetings. But we are still encouraging clients and Kenyans to ensure that they go to be tested if you feel like you need to be tested. But as well, we have given guidances for some certain populations that the services have to continue. For example, pregnant and breastfeeding women, clients who are suspected with tuberculosis or with malnutrition, or if you have any, partner testing or family testing, that one we urge still that it should continue. And as well, we have moved to HIV self-testing. That I think about the several HIV self-tests that we have that are accessible, especially in the public sector. It is free, but however, in private sectors, it's around 500 shillings. And so we are making it more available for the clients to be able to know their status. But there has been a decline, but we are a bit stable now. And when we have decreased testing, linking to care as well is affected. When it comes to clients who are already, the people living with HIV, the ones who are already on treatment, that has not been affected. In March this year, when we had the first case and the guidance was given by the Ministry of Health, regarding to restrictions in movements and lockdowns. What we did is we gave a guidance as a Ministry of Health to ensure that we still have to have continuity of care and that they do not miss their medication. So first is the health facilities all over Kenya were urged to request for 4 months of medicines supply now within the facilities. So as we allowed all our clients to take 3 months multi-month dispensing with them. Before, it was a bit restricted to clients who are not suppressed and certain age could not take the 3 months. But now we allowed them, so as they can be able to, to avoid the movements, to avoid them being predisposed, and we are still learning more about COVID-19, yes. And then what has happened is most of clients have utilized that, call it differentiated service delivery. But as well, we have something else called community ART groups, whereby within a facility you'll have like a team of 12 or 15 of people living with HIV. Then they'll have the team leader who will go to the facility, pick the drugs on behalf of the, of the other clients and go and give them within the community. So you see, it reduces, the movements for them and predisposer. And then as well, you have something else, another track, a model called Fast Track, where clients will come directly and pick their medication and just go home without having to line up a lot. However, the clients who need clinic appointments, they still continue to access, the healthcare workers within the health facilities, but they the clinic appointments are staggered, so as you do not have clouding within the health facilities. So yes, so we are doing good. So far it is stable.
So far, so good.
Yes.
Okay, Nelson, I understand you're now with us. You can hear me clearly. Quick one. There's something that Victor and Doreen have brought up, the way the challenges those living with HIV have been facing, especially when it comes to nutrition and the taking of medication. Have you done anything from the point of view of NEFIC in supporting the same?
Thank you very much for having me. Yes, sorry I came in slightly late, but I'm happy now I'm here.
Continue.
Yeah?
Yes, I can hear you.
Yes, and thank you very much for having me, and thank you very much for having us here. My name is Nelson Otuma, as you said. I work with the network of people living with HIV, which is NEFAC, and we work closely with the Ministry of Health, particularly through NASCOP, of which today we are here with the head of NASCOP, and both the colleagues that you've been talking to in this subject, both Doreen and Vicky, are part of our team.
Do you work with a network of people living with HIV? Some of the challenges that have been brought up is a lack of, proper nutrition, even as those living with HIV have to adhere to taking their drugs on a daily. How are you supporting them?
Yes, there have been challenges, and I just came in when the head of NASCOP was trying to explain to you how we are coping with the issues of COVID, the pandemic, and how we are ensuring that there is continuity of services. So I have to admit that there have been challenges, but I also have to say when all this came up, we were the first to write a letter to the Ministry of Health through NASCOP. And this is because there was fear, there was anxiety, and people were trying to stay away from facilities. And as the head of NASCOP has explained, the challenge of fear has been addressed through education, but the access to medication has been made easy because they've implemented what they call differentiated service delivery, and that is what has been explained as people having multi-month prescription of pills, so they don't need to come to facilities practically every month. Ideally, if you are starting treatment, you need to be presenting in facilities for some people even weekly, so that they monitor reactions, and mostly also for other people you come monthly. They give you new pills, and also they monitor how you are coping with the treatment. And remember, in this country, we have over 1 million people who present in facilities for HIV drugs. That is a very huge number, and would result into crowdings. And easily we can give the example of Mbagathi. Mbagathi, ordinarily, if there is no COVID, you go there, you see a lot of crowd. So to solve that problem is the letter we wrote to the Ministry of Health to give for longer periods of time so people don't come to facilities more often and avoid crowding.
Okay, and for those that are saying their social economic status has greatly been affected, so even getting proper nutrition is a problem, how are you supporting them?
Yeah. Actually, that is also a big problem. People have lost jobs, some have lost incomes, and we have tried in a small way with a number of partners to leverage support. Particularly, we started with UNAIDS that give us food vouchers and food ratios. There are other partners like the Kenya Red Cross that also came in to support. But it is something that is also very paltry. We have also linked our members with the social protection, the support that the government gives through chiefs and social protection committees. The challenge with that is only those who are open their status who are going there, because the chiefs really want to know your vulnerability. Why are you vulnerable? And of course, not everybody who have HIV may be vulnerable. Only a few of them may be vulnerable, particularly in urban informal settlements and villages. So that is a need that is there, because people need to eat properly when they are on medication, and we continue to hope that it can be expanded. We have also put a request to NASCOP to help us talk to partners like the World Food Program, and UN needs to expand that.
Okay, now Doreen, it has been said in quarters that HIV and COVID seem to sound like relatives in as far as how the messaging is being done around them and of course the stigma around it. Speak about the same.
So part of the problems we have with HIV in the HIV response is stigma and discrimination. And we have seen that a lot all along the years, especially with the stigma for HIV. You know, the way Victor said that he was shown two people on a chart, one was thin and the other one was healthy. Those are still issues that keep coming up. Like every time I say I am living with HIV, because I do daily posts on my social media handles, and I say I am living with HIV, I give some encouragement and all that. And people are like, you don't look like you have HIV. Some people say I am actually paid by the government to say that I am living with HIV. And then they like it's all about, even when I have actually taken my treatment live on social media, but still people keep insisting that those are not ARVs, those are just Panadols or some other form of medication, but they're definitely not ARVs. So with this challenge that HIV must have a look, it's the same way that people keep looking at COVID. People look at you, if you're coughing, then you're probably susceptible to having COVID. But if you're a normal person with no symptoms, then they're like, probably this one is okay. So the thing is, we have to know that none of these viruses have a look. They don't have the way they look like. So you wouldn't look at a person and say, this one has HIV. You wouldn't look at another person and say, this one has COVID, because they are coughing, because definitely they might be coughing because they have a flu. There's always been flus even before COVID. And also the issue about the messaging. A lot of people tend to think that, are still stuck with the mentality we had in the early 2000s, that ukimwi unaua. And people know that HIV is a death sentence, and there is not, you can't change that mentality because they already know that HIV kills. And it's something that even as we were learning through schools, we were told HIV is a bad thing, it kills people, so don't get anywhere near it. The same thing applies to COVID. People are like, no, I get COVID, I die. That is a death sentence. Yet we know people who have recovered. Now you'll find people who have come out and said, hey, I had COVID, but now I am fully recovered. And they're like, no, you did not have COVID. Your treatment, why is it that your treatment, your recovery process was shorter? Why is it that you don't look like you're sick? Why is it that you're not doing this and that? Like, we expect a particular thing from someone because of what we have had. So I think mostly this stigma and discrimination comes through because of the misconceptions and myths around both viruses. And we tend to listen more to a lot of conspiracy theories and things that we believe are true, yet they are not true.
Okay, and Victor, seeing that you're the one who was shown the two pictures and you were so young, at some point it caught up with you exactly what the doctor was trying to insinuate. How did you deal with that? Because I can imagine you were fearful, right?
Yeah. So at first, I can say it was a lot. It was a lot to take, but when it caught up with me, I was around 16, 17. That's when the teenage life starts to kick in, and that's when I started to think through where do I want to be in the next probably 5 to 10 years. And my plan was like finish school, finish high school, go to campus, get married, have kids, final. But looking at my status living with HIV, I was like, so because I have HIV, I can't really have kids, and I can't really like build a career because I have HIV. And that's when I started like not being serious to my books, to my friends, and I started secluding myself. So I was an indoor person most of the time. And when I was asked, "Mbona utaki nje, mbona uchezi na sisi?" like, nah, it's not my thing. My thing is just being at home. It was challenging.
Okay, and how did you overcome that?
Well, it comes to a time that you have to teach yourself how to live with someone or something. And when that time came, I was like, so this thing is here to stay. hakuna time itafika that itaisha. So it's me to just love myself. If I want to be loved, I must love myself. And that's when I started going to support group. And support group really helped me to like start now like coping with living with HIV.
Okay, and Dr. just listening to both Doreen and Victor, the messaging around HIV is very critical, but we have seen over the years, especially recently, we're not seeing much of it going on. Why did it stop?
It hasn't really stopped. It's just I think we have really saturated the information, the public, but as well we have a lot of advocacy and communication still going on, in the health facilities, and as well we thank especially the communities who are leading now the champions, passing on the information, especially when they come out that even if you're diagnosed with HIV, it's not no longer a death sentence, as he was explaining, that you as long as you take your medication, you're able to live a normal life, finish your school, get married, and be an engineer, be, a pilot, whatever you want to be, doesn't stop you at all. And you can live up to 70 or 80 years old. So in communication, I think with years, like for example, for the last 30 years, the stigma and discrimination has a bit at least reduced, okay? And especially when you have had the medication, not knowing that you can live for long. When you know that if I get diagnosed today, the probability of me living up to 10 years, as Doreen has said, she was given only up to 12 years, But now, if I take it, there are others who have lived even beyond that. That doesn't define your life now because they've been diagnosed positive, I think the messaging is there, and especially the peers and, the communities are really doing that. But as a ministry and through NAC, there's a lot of that going on behind the scenes, a lot of documents and as well education. Right now, for example, we are grateful to the Ministry of Education. Last year, we developed a teacher's guide in regarding to HIV that is going to be taught in schools, either in lower classes or even upper or even in high school, to know more about HIV, and that it should not really define someone's, being diagnosed does not define that it's a death sentence anymore. Yes. Yeah.
Okay, and Nelson, we definitely have made lots of strides, but now the flip side is that we have a generation that is not afraid of contracting HIV and are living a very colorless life. And to be specific, a report said that the younger generation, the youth between 15 and 24, are more afraid of getting pregnant than they can or are of contracting HIV. And actually, we went out to the streets to find out why exactly. Take a listen.
We, the Kenyan youth, would rather deal with a sexually transmitted disease than a pregnancy. I went out to find out why.
It's more about the young people living a carefree life. I don't know what's driving them to that, but you find most of them, they don't care. They're like, if kama ni ugonjwa kuna ARVs, unaona. But pregnancy, they don't want that responsibility, like now take care of your baby, take care of the responsibility that come with the baby.
Because a pregnancy is permanent and it will change your life, but an STD you can live with it, and you can zingine hata watu wanapona.
I would say that the message of HIV out there, it's been inakuwa kama kawaida. So I think the sensitization has gone down a bit. So, and with the new generation that's there is, most people are not putting it into consideration.
Kwa wenye tuna engage na wale, sana sana kwa wale wenye nabeba, mtu anakuambia afadhali akuwe na STDI badala ya kuwa na mtoto, juu mtoto labda mzee atatoroka na atashindwa kulea.
For me, I care more about my health. I don't worry about pregnancies or anything, but health comes first. Pregnancy is something you can deal with. The children will come, you'll take care of them. But for my son, I'd rather take care of my health before I think of pregnancy.
So people are not using protection. They're not going to get tested, because also there is that stigma. So if we're able to work with the stigma and also getting more information to the youth and telling them they should be out there and know their statuses, then we are going to help reduce the cases.
For NTV, I'm Brian Mushiri.
Interesting perspectives there. Nelson, what is going on with this younger generation?
Thank you very much. I think on my part, we need to educate people more about HIV. Yes, we have worked hard and we've made sure that we've normalized HIV, living with HIV, and it is a normal chronic medical condition, as I've said before. However, we need to advise younger generation that it is not fun having a lifelong medication. And lifelong medication, remember the inconvenience, remember also the cost to the government, even though they provide it free. If you are put on a lifelong medical treatment, that comes with a lot of issues and a lot of consequences. Mm-hmm. So we still need to educate people to understand that they need to avoid HIV at all costs without stigmatizing it. And that is the education that we need to intensify so that we end AIDS, because even this country has a commitment to end AIDS as a public health disaster by 2030. That will end if people who are positive are on treatment and are virtually suppressed, and people who are negative are taking precaution so that they don't join the pool of new infections. I also wanted to touch on what part of the subject you dealt with earlier, which is COVID, issues to do with stigma. And I think stigma in HIV is because it's associated with sex, and that has been confusing even for people who are born with HIV. Mm-hmm. I think COVID more is criminalizing, using the Public Health Act. It is like having COVID, you failed to observe Public Health Act, and therefore I think the way it was initially being approached, that is what brought issues to do with the stigmatizing. But I agree with you, we need to educate, intensify our education so that people really avoid any kind of medical condition, whether it is a flu or whether it is malaria, and particularly HIV. We need to understand that, yes, it is a lifelong medical condition, there is treatment, but at a cost that we need to avoid. So we just need to avoid new infections.
And that kind of mentality has actually shown with the numbers where new infections are actually higher within this same age group. Let's hear from somebody who lives this reality. Doreen, what is your words of advice and wisdom for those that think this is an easier burden to carry?
Let me just say a 1-minute story. In 2011, I stopped taking my ARVs because I felt that HIV was defining me, and I did not want to live with this condition anymore. So what I did, I actually saw Babu Aloliondo on TV and decided, you know what, I am going to Tanzania, I am taking my cap and becoming HIV free. So that is what I did. And then 2 years later, I was still HIV positive after I got pneumonia, and it almost actually killed me. So the doctor asked me, why did you stop taking your medication? You were told that this is a lifelong disease, this is a lifelong commitment, you have to take a medication. So I just looked at that doctor and I was like, this doctor does not take care of this. This doctor does not know how I feel every day taking this medication. So he probably will not understand the reason why I need a cure for HIV like yesterday. So after a while now, when I later on accepted my status, I realized that I was giving HIV too much power over my life. And that is actually what led to me starting my initiative, I Am a Beautiful Story, just to give hope and encourage people that there is a beautiful life even after HIV positive diagnosis. However, it's not an easy journey. It is a journey that most of the time you're living, especially if you have not reached that point of acceptance, you're in too much denial, you want a way out, you don't want to take the medication, your life revolves around the fact that you have to take medication every day. And taking medication every day is not something that is easy. So I can tell people, if you are HIV negative, stay negative. Nowadays we have a a lot of prevention measures. We have the condom use, we have PrEP as a HIV prevention measure, we have treatment as prevention, which is now when I'm undetectable, I cannot transmit it to anybody else. But we might make HIV look like a normal thing, like something that it's fine, you can live with it for a very long time. Yes, you can, but it is a process. It is a process for you to actually reach there psychologically. So if you are able to stay negative at all costs, and always know your HIV status and that one of your partner, because at the end of the day, it is your health is your own responsibility. And if you're HIV positive, accept your status. Don't let HIV define you. And as I said, HIV is a very tiny virus. Don't give it power over your life.
Very well said. And if we have Victor now, I'd like him to tell us, as a guy, we have seen the numbers saying the youth are increasingly engaging in sexual activity at a very early age. You're a young man. This was a challenging age group for you. How did you handle it?
Well, you know, a support system, it's really, really, really important around a young person living with HIV, because you tend to get, you know, misinformation from your peers. Young people listen more to their peers than their adults, and lack of a better word, I can say the older generation has neglected, lack of a better word, has neglected the young people. So young people tend to seek information from either the internet or their peers. And so if I'm a young person and I want to have sex, I'll go to my other young person and ask him, like, hey, have you ever had sex? And he was like, it's okay, it's not a big deal, and so he won't give me the right information, and with the curiosity, I'll go and probably try it, and that's when now you find new HIV infections and other STIs and pregnancies. So it's high time that we start having conversations with our children, with our teenage boys, with even our grown-ups. Brothers and sisters.
Okay, and Doreen mentioned the use of PrEP as some of the ways you can actually prevent HIV, but then again, there has been reports of a misuse of the same. Talk about what PrEP is for to start with, Dr. Eri.
Thank you. PrEP is pre-exposure prophylaxis. That means, for example, if you are in a relationship or in a situation and you know that you are predisposed to acquiring HIV, and so to protect yourself, you take, they're still ARVs, you take them daily to ensure that you build up immunity for you to acquire the HIV virus. So the PrEP is mostly, for example, if you are married or you are in a relationship and your partner, notice maybe, that they are cheating, or they're in a way that you're not the only one in that relationship, so you are predisposed to acquiring HIV in a risky, behaviors. Then you take PrEP to protect yourselves. That is one. Or, for example, if you have discordant couples and maybe the other partner has not virally suppressed, so a client will take it so as they do not, acquire the HIV. But as well, we know, yes, it has been misused. That there's this notion that if you take it, like on Friday, then on Saturday and Sunday, you can do all that you want, and you will not be able to acquire HIV. However, that is not true. That you need at least to take it for quite a number of time, like around 14 days, for you to acquire that immunity, and continue taking it. So as you build up that, stability to ensure that you do not acquire the HIV. So you cannot take today. It's not like the morning pill that you take now and you're protected, the next minute. No. You need to take it for quite a number of days. But we know that has been misused. And as well, people who are taking it within our health facilities, they take it. So retention is an issue because some will come and pick, I'm having a date, or in this relationship, they take it for some time, then after that they stop. Then next they come. In fact, it puts you at more risk of acquiring the HIV because you're taking it, you're not continually taking it the way you're supposed to. So you'll be thinking that I'm protected because maybe I took it today or I took it last week. No, you have to continually take it. But also there are other measures beyond PrEP, using of condoms, condoms that protect both from pregnancy and even the STIs. But I think I want to touch on the issue of sexually transmitted infections. Now we know HIV is one of them, but we have others, especially gonorrhea, we have as well chlamydia that is there and has more effects. The consequences of having gonorrhea and chlamydia are even more worse. For example, we have some data from in one of the counties in the country that for clients who were taking PrEP, that first they were being tested for sexually transmitted infections, specifically for chlamydia and gonorrhea. And there were girls between the ages of 16 to 25. And we had around 32% prevalence of chlamydia and gonorrhea. Now, you can be able to treat gonorrhea and chlamydia. It's easy. And in fact, like for girls, it's a bit hard to diagnose because, the normal discharge, a lady normally has, you can confuse it that it is normal discharge, yet it is chlamydia or either gonorrhea. So what happens is, like a lady, you're assuming because it's not painful. However, the consequences is infertility. 10 years, 15 years after that, you are infertile and you're wondering why. But it's that infection that you got in some time back. So to these young girls between 16 to 25, they are tested for it before even they take PrEP. And remember, when someone is taking PrEP, that means that they are not protecting themselves. So when they're diagnosed, that means that even prior for them coming to access PrEP, they were already in relationships or sexual relationships that they were already predisposing themselves not only to HIV, to pregnancy and to other STIs. So I think that is that's one of the things that Ministry of Health through NASCOP they are doing to educate the public about other sexually transmitted infections, which have more dire consequences and know that the treatment is there. Because I think when HIV came, we focused more on HIV and forgot a bit of the other sexually transmitted infections. But we have noted with the data coming in that that's an area we need to, to address it. And I agree with Nelson that honestly, yes, this age group, especially the young ones, adolescents, we have noticed, yes, they have high new infections, especially in the country. Almost to 42% of the new infections in the country is coming from that age group. That's the messaging. But as well, they are not, us who are a bit older, the way we pass the message to them, they query everything. So we are asking them, could you come in and they are with us, help us to know how do we package this message that it's going to be appealing to you and be able to, to protect yourself and as well spread to the peers.
Okay, yes. Now this conversation continues right after a short break. But before we get to the break, our question of the day to you has been, why are the youth more afraid of getting pregnant than contracting HIV? And we see you talking to us. Remember that hashtag new normal. Kipruta says, HIV is a personal mess. You can hide your status for as long as you want, but having a child is something you'll have to contend with. Explanations, and as the time goes by, it gets even worse. So yeah, HIV, it is interesting perspective, but then again, you've heard about the consequences of the same. Faith Kamene says, because we lack moral values in the society and the majority of the youth cannot fend or sustain themselves. They lack a sense of responsibility into adulthood. Babies taking care of babies only that they are baby adults. That is the harsh reality. Renee Sibo says, they say pregnancy can be seen with naked eyes. HIV, you cannot know someone has it without testing, especially if they are taking their ARVs, so they'd rather be sick than pregnant. Renee, we hear you. Another here from Isaac Wekesa, who says the cost of being a parent is more of an expense than taking ARVs, and then AIDS has no power as it's becoming weak as time goes by. Well, again, it's a double-edged sword, as Doreen made it clear. Abbas Peter says HIV you can get PrEP within 72 hours and get rid of it, but pregnancy rather is like starting responsibilities which you are not ready for. Again, HIV is a responsibility in itself and a lifelong one. Kiprotich Mutai says simple, just because of the shame. Pregnancy is visible, while HIV is something they have seen it as a peanut. We are not serious about life. Felix says securing abortion is more deadly as compared to HIV, which you can manage through ARVs. Felix, that is a very interesting point you put there, but a reality. We keep taking your comments, that hashtag new normal, as you tell us why you think the youth are more afraid of getting pregnant than contracting HIV, even as we understand how living with HIV in these times, and of course the strides we've made as a country in fighting this scourge. Stay with us.
Nondo is a network of grassroots, community-based organization from 14 counties. It's the first disabled persons organization that advocates for the rights, inclusion, and participation of disabled persons from northern Kenya and other ASAL counties.
Nondo iliwaza kitu kizuri, kitu muhimu kutuleta pamoja.
Mambo kama hiyo ya beauty ni yenye hatukuwa inatambulika, imetukutanisha sisi wote.
Tunaweza kujitokeza, tukajikubali, tukaona pia sisi tuko na beauty.
It's our responsibility to wear a mask, use sanitizers, and wash our hands with water and soap.
Change can be disruptive, but Business Daily has got you covered from Monday to Friday. Get evolving trends, ingenious business ideas, and the latest tech content in the new market dynamic, and exciting lifestyle content in the new normal environment. Business Daily. More possibilities.
The annulment was granted.
No! No! But I have a bad feeling about this.
Gail needs me now.
It was their plan all along to take your child.
Our problems are over.
You didn't leave any evidence?
Yes, Dad. I learned from the best.
Help! Help us! Help! Anna, Gail!
We'll suffocate when the oxygen runs out.
I just lost a loved one, and I won't lose you too. I'm not going to let that happen.
Vina vegetable oil stays liquid to the last drop, so it's smooth cooking from start to finish. Now with an easy-to-pour cap. Mapishi poa, madishi poa.
Are you a business owner? Sign up today to accept fast, easy, and secure payments through Visa. What's more, enjoy flexible financing options for your business. Call us today on 0703 095 445.
Thank you for staying with Your World. My name is Gladys Gachanja. Today we talk about living positively with HIV, and I'm still joined by Dr. Catherine Goge, head of NASCOP, Nelson Otoma, CEO at NEFEC, Doreen Moramo Chacha, who is living with HIV and also an advocate of the same, and Victor Keruki, who is also an advocate of HIV. Thank you all for joining us. And even as we continue with this conversation, officials of a health group at the Whitcoppen clinic performed free tests for HIV and tuberculosis, as well as coronavirus screening to residents of the Diepsloot informal settlement west of Johannesburg.
What it looks like. It's a version of. No.
Now, Nelson, there has been a lot of debate and talk and, of course, sensitization about opportunistic diseases that come with HIV. And actually, to even mention something that comes close to many who have been in the fight against HIV is the passing away of Inviolata Mboavi in end of July. And I understand she succumbed to TB, and she was actually the first CEO of NEFAC, right? Nelson, can you hear me?
Point like I missed part of what you are saying.
Okay, I was mentioning the fact that we lost Inviolata Mboavi to an opportunistic condition, which is TB, end of July, and she was the first CEO of NEFAC. Talk about the effects of these diseases.
Thank you very much. Now I get you. Yeah, so as you say, Inviolata was one of the pillars of NEFAC, one of the founders. He was an encouragement and a motivator for young people. Usually when we lose such people, then a lot of people feel discouraged, particularly the young ones. And we hope that they are not. Death is the nature of a human being, even if without HIV, people still die anyway. Yeah, so this is something that we are still dealing with and reaching out also to the family and also to the members and friends of our colleague. And we hope that it is not a big point of discouragement. As far as we are concerned, she had complications related to other conditions rather than HIV, particularly TB. But what the lesson we learn is that people who have HIV are still vulnerable to other diseases and conditions, and they get sick with malaria, they get sick with pneumonia, they get sick with other conditions. And in the era of COVID, that is why we are also taking precautions so that people don't get COVID. And if this is diagnosed in time, any condition that comes to people living with HIV will be managed and will be treated, and they will continue to live like any other person. The reason why we encourage people to religiously adhere to their HIV treatment is that then you are virtually suppressed and you are like an HIV negative person. So any sickness that comes, your immunity is strong and you are able to ward it off. I hope I responded to the specific question you wanted, but I'm happy to get more into this if you have a further follow-up question.
Thank you, Nelson. I'll cross over to Doreen, and we slightly touched on the importance of disclosure, and disclosure has been one of the other things that has been said to actually increase those numbers in as far as new infections amongst the youth. Is this an issue, and why is it an issue?
Disclosure is an issue because, as Nelson said before, a lot of people tend to associate HIV with having sex. So the minute you say, I'm living with HIV, the next question that comes after that is, how did you get it? And some people are like, so you already started having sex as an early age as this one. How many people have you slept with and all that? So a lot of people tend to not want to disclose because they want to avoid all those questions of how did you get it, when were you infected, who infected you, how many partners did you have? And most of the times I tend to say nobody really owes you disclosure. it's a personal choice. So you can decide, hey, I'm going to disclose to this person and tell them I am living with HIV. But most of the time it's encouraged because you are able to get a support system. Because living with a health condition, you do need all the support that you can get. You do need a caregiver, you do need, like not a caregiver per se of in a manner that you're like bedridden or anything, but just somebody to be with you in this journey. And that is actually why disclosure is important sometimes. So if you can, it's not very necessary that you have to tell everybody, hey, I'm living with HIV, but you can get one person whom you can have as your support person, who when on those days you feel like, today I do not feel like taking this medication, they tell you, you know, you have to keep going. So you need one person at least who knows that, who will hold your hand throughout the journey. And that is where the importance of disclosure is. And for partners, I do feel like it's very important, especially if this is your sexual partner, maybe in a relationship or you're married. I feel like it is important for you to tell them so that they know that this person is living with HIV, and you are able, if they are not living with HIV, you're able to take care to ensure that you are taking all the precautions involved, like using condoms regularly. Because if you don't tell this person and then they find out later about your HIV status, it might not be, they might not react well to the fact that they have found out with HIV.
Okay, and speaking of which, Victor, you had mentioned you have dated in your lifetime. How did you disclose, if at all?
Well, it was a process. It was a process. I didn't just wake up in the middle of the night and disclose. We dated for a while, and during the dating, before disclosing, it was, we'll just meet in public place, because we're avoiding the house dates and other happening. Until when I disclosed, at first she didn't take it like normally. She had like first to let the information sink, and I really loved her, and she went silent for like around 2 months, and then when she came back and she told me like, oh, I'm sorry, I was silent, and I really want us to kickstart it. And we did it for 5 years, and unlike other normal young people, relationships do have ups and downs, and unfortunately broke up after 5 good years.
Okay. Now, interesting that we talk about disclosure, and we know the role it plays in as far as the new infections is concerned. Talk about how that is critical in fighting the scourge and even for your own personal benefit.
Thank you for your question, Gladys. It is very important for you to, when one is diagnosed with HIV, to disclose their status. One is, it begins the journey, as Doreen was stating it, the journey for you to, healing and be able as well to deal with the situation that you are in. One is now you are able to know how to take care of yourself. And secondly is, for as well your life to continue, because it doesn't stop there. And the more is as well, you'll be able to adhere to your treatment, and the more, if you religiously take your medication the way you're supposed to, then you virally suppress and you're able to continue with life like anyone else. But it's not an easy journey. As Doreen and Nelson has talked about it, that for you to get to that point you accept, it takes a lot. And yet, yes, you need that psychosocial support, from the facility and even within your own circle. You are in a circle either from family or from friends, so as to continue with it. Because there are those days you'll be down, the other days, you'll be up. For example, you've heard what Doreen has explained. There was a time came and she felt, 2011, I don't want to take this medication anymore. So you need that person who will be able, to keep you, encouraging you to take it. And if, when you have accepted completely, then you are able to continue with your life. Now, let me give you, we have psychosocial support, especially within the health facilities. And for example, when you are diagnosed there, the counselor is very, very important. How they're going to break the news. Yes, you read from the kit that you're positive. But now from the next words coming out, are very, very important, from the counselor to you, to show you, because that time you'll be bombarded with a lot of questions, with a lot of fear, that needs to be answered, like other people have lived, other people are living with it, and this is how they've been able to get even children who are HIV negative, because that prevention of mother-child transmission of HIV,
Yes.
you're able to continue to have a normal family. And that is why it's very important when you're having the psychosocial support, that within the health facilities, we should have the peers, someone who is wearing that shoe, who knows where it hurts and what it needs. I found it one time, it was very important. I was in a health facility in one of the counties. And, as a health worker, you just tell the client, take your medication in the morning and in the evening. However, when they talk to the peer, tell you, when you take this one, you usually feel nauseated or you feel like vomiting. So when you're taking it, please take it with Uji. You see, now as a healthcare worker and not wearing that shoe, I will not know that. But so talking to the peers helps the clients know how do you cope with this disease day in and day out.
Okay, yes. And speaking of which, HIV has been a reality across the globe, and Uganda, our neighbor, have always had a high prevalence of the same. And 28-year-old Gonzaga Sentongo is a resident of Katabi Town Council in Wakiso District. Over the last few months, when the pandemic struck, Sentongo has been cycling nearly 22 kilometers to Mild May Hospital in Lueza to pick antiretroviral drugs for people living with HIV in his community. Sentongo said he was making the frequent bicycle trips because the lockdown in Uganda had made it impossible for the people who need their life-saving drugs to travel to hospital to refill their medication. Here's that story.
I personally, I chose to be delivering medicines to other people. So since you understand, before it was strict, no transport, not public transport, and I had a bike and I had a passion to do my work. So I decided to, let me use the available resources.
Apologies for that. That is not Sentongo, but we shall be playing that story later on. But let's introduce Sentongo into this conversation. Thank you for joining us all the way from Uganda. You have been volunteering to actually take these medication to those living with HIV. Why?
Yes. I beg your pardon?
Why did you volunteer, and why did you feel the need to actually take up this role of getting the medication to those living with HIV?
All right. First and foremost, the Bible says in the book of Matthew chapter 25, verse 37, Jesus himself said, I was sick, you took care of me. I was in the hospital, you were able to visit me. I didn't have food, you gave me food. And I didn't have maybe medication and all that, you helped me. So basically, we base on that to help people. And two, in the book of James, chapter 1, verse 27, the Bible says that the only religion is that kind of religion which can care for orphans and also the widows. So in this case, we have these people who are affected by HIV, and also talk about the lockdown and coronavirus and all that. These people, they were in a difficult condition. They couldn't help them out. So they needed a helping hand out there to volunteer and to help our people to see that they can also be in a good condition. And remember, some of them, they are young. Talk about 80-year-old girl, 7 years, and even these vulnerable women, they are just widows, and their husbands passed on, so they don't have any help out. So, and even the distance from where they stay and also to the health facilities, talk about hospitals where they are supposed to get their ARVs from, it is really a longer distance. And there is no this kind of public means. They were completely banned of public transportation. So they were no means of transporting themselves from where they stay to their health centers. And the days of getting their ARVs had already passed. So they needed someone to help them. And they were weak, they are sick, they are young, So indeed, you can see really that there is a big need for someone to volunteer or to come in and help them out.
What are the other challenges you've seen those living with HIV facing during this pandemic?
Of course, first and foremost, they are unable to access their health facilities. Talk about ARVs. 2, they are unable to get food. And the health workers have been really emphasizing that anyone who is affected by HIV must take good meals in order to activate to boost their ARVs reaction. You get my point? So lockdown, these people are no longer working, and some of them, they were sacked out from their jobs where they were working from. So it's really next to impossible for these people to get help. So those are challenges: transportation, lack of food, like even this kind of social gathering based and also based community support. They are unable to get their help.
Okay, and is the government in Uganda supporting them, at least when it comes to nutrition?
It's really hard and also difficult, because even during the time when it came to give out food, remember they were required to have national IDs, you get? And some of them, they do not have national IDs to access like those kind of enough food. You get my point? So the government does some little work, but again, the NGOs must come out and help.
Okay, and do you operate on your own, or are you part of a bigger group?
No, we have an organization called New Dawn Africa Foundation. It looks after people with HIV. On a monthly basis, we get some kind of support from well-wishers, donations, and all that. On a monthly basis, we give them some food like posho, beans, rice, and also some bit of sugar, depending on what we've got from our well-wishers, and those people can really help us to run the organization. You get my point? So these are the organizations which can help the government out there where the government can't reach, because these people, they stay in slum areas, and they are also in the islands, because the Wakiso district is bordered by lake shores, islands, and you know what takes place on around lakes. They were that kind of spread of HIV, the women and the husbands, so they can move freely. There is no that kind of orderly way, and they pass. Some of them, they die. So that's how you can really see that there is a need. So government can't come to this kind of local areas. So it's those kind of non-government organizations which can really come out and give a help to these people where the government can't reach.
Okay, now Sentongo, we met you in season 1 of this program, where you were on a bicycle actually providing or taking this medication to those living with HIV. But since then, I hear that you have been upgraded. Tell us more.
Yes, I was riding a bicycle, as you can also see. This is the bicycle I used to ride and moving the longer distances. So from there, we were able to, some of our well-wishers were touched, who saw the story, and they were able to donate us this kind of motorbike, you know. So we can really move a long distance, you can also see. So some people came in after seeing that story, and most of them, they were touched, and they were like saying, how can I really help, and come in, and we do that kind of, we do together. So they were able to give me that. So at first I was riding that kind of bicycle, as you've seen. Yeah. It was really tiresome. Of someone could fall from a state of unconsciousness into exhaustion. So you feel like a lot is left to be desired. You get my point. So you sweat. You are unable to cover a longer distance. And remember, we have to travel from one district to another, almost 40 kilometers, 60. And remember, these people, they do not stay in one place. So you can find someone who's staying on another village, the other one is in another village. So you have to pick their ARVs cards from different locations. Then you take them together to the hospital and you correct each and every one of the drugs. So it was really tiresome. So now I can really thank God for what they have donated to us, motorbike. Now I can multiply, and also like where I was covering almost 40 kilometers, now I can multiply it by 3. So meaning 120 kilometers can be covered. And also the scope had to become wide. You know, we were able now to go to other districts because we used to stay within Wakiso, but now we can go to other districts and expand the network. And two, some people, they didn't know that we were helping, and some of them, they are just being there. I don't know how they can really get help. After seeing us on this kind of social media and TV and all that, they were able to give us phone calls, come and help us, come and help us. So even because we look after almost 65 families and more, but now we've got more other people who are in need. So this motorbike now, it has our work. So, and we are saying that indeed, if God can also open more doors, we can even get someone who can donate us with a van, and we shall be able to carry even more children and also vulnerable women, because sometimes when you go to hospital, they can ask you their status, their blood, viral load, and you are like, how can I really help them out? And they are like, can you bring them here? You know, so I just have motorbikes, so you can't carry almost 10 people. And I've told you, we have almost 65 families and more. And some of them, they are children. Some of them, they are women. And also some kind of advanced people, advanced in terms of years, they are old.
Yeah.
So you need to have a plan and pack them there, and then you go and you do extensive work, and also you do it massively, and people be touched and be inspired. And also other people can copy or borrow a leaf and help this kind of people who are in need.
Okay, Gonzaga Sentongo coming to us from Uganda. Thank you so much for the work you continue to do on behalf of those living with HIV. May God bless you. May He keep you safe, and we wish you good health. Thank you for joining us.
Thank you too.
All right. Now, the National Council of Churches of Kenya launched a one-year program aimed at empowering men to actively engage in the fight against HIV and ensure Kenya will have zero HIV infections by 2030. We are now joined by Reverend Canon Chris Kinyanjui, who is the General Secretary of the NCCK, that is the National Council of Churches of Kenya. Thank you for joining us, Canon. And why the men?
Thank you very much, Gladys, and happy to join this show this morning. The National Council of Churches has been working on the HIV/AIDS since the pandemic was declared some years back. And by grace of God, we have maintained and retained our involvement with the people and the communities. So for right now, as we speak, the annual infection rate is averagely about 36,000 people, new infections each year. And after working with the partners and the research that has been done in the country, there is a weak link that has been found in new infections. And that weak link is the men. And that is why for us as the National Council of Churches of Kenya, together with our partners, the Christian Health Association of Kenya and our member churches across the country, we decided that for 1 year, we will focus on the men. We'll focus on the men for about 4 or 5 reasons. One of them is that men do not know their status. Among all the population sections that we have in the country, men do not know their status because men avoid going to hospital at all costs. And therefore, they don't test and they don't know. Now, that also means that they don't seek treatment for HIV-related infections. And that obviously now is not just bad for the men, it's bad for the women as well and the children. And the third issue is that although men have the leadership in the families, we find that their leadership in the family is so critical in ensuring that they are delivering the message of hope in the family. So men don't know their status, men don't go to hospital, And then men also have a higher chance of transmitting HIV and AIDS more than women. And then because they don't seek medical attention, their viral load is very high. And therefore, their chance of transmitting it in the community is high. And that actually jeopardizes all the chances for everybody. So we feel as the National Council of Churches, by focusing on the men, we are going to achieve the objective that the country has set, to make sure that we have 95% of people living with HIV/AIDS to know their status, 95% of people diagnosed with HIV/AIDS to be on treatment, and the third issue is for 95% of the people to receive treatment and have their viral load suppression. That is the reducing of the virus in their blood.
Now, Reverend, what's the success rate so far, so to speak?
We do have success. We have been talking to men. Within our churches, we do have the men fellowships and like the Kenya Anglican Men's Association, the PCA, PCMF, and the others. And we are talking to them because that is where we begin, that they open their families for them to actually be tested for HIV/AIDS. The second success that we have had is to encourage the men, and we have seen more men actually taking up the testing, because the testing is the most important thing for them to first know their status. Men have a lot of fears, and those are the fears that we have been trying to address. One of the fears is that men fear that health-wise, if they are HIV positive, they will not live. And we are encouraging them to know that if they know their status, they can still live a long life if they are taken through the right counseling, the right psychological support, and they take medication. The second one is sexuality. Men are macho and they want to be strong. And it is not a good thing for a man. They don't feel good when they are saying, I have HIV and AIDS. And therefore finding partners if they are single, or staying with a partner if they are married, becomes a bit difficult. The third issue is family relations. Men are the leaders of the families, and when they have the status, they feel that if I know my status and people know that I have HIV and AIDS, then I'm going to be weak. So we are encouraging them to know that by knowing their status, they will actually be strong, and they can encourage even additional people within their communities to actually go for the test and live positively. And the other one is marital breakdown. A lot of men who are married, when they get positive, sometimes they fear that their marriage is going to break. So we are talking to men as well as the women and the community to embrace these men who are courageous enough to go and take an HIV/AIDS test, and to say that men who have tested for HIV/AIDS are the heroes of the community. Because unless we help the men to go and take the test and live positively and take medication and give them support, then we are still going to have the 36,000 people getting new infections in the country on an annual basis.
Okay, now we'll take another short break on Your World. When we come back, would like to hear from Dr. in as far as how such interventions have helped in the fight against the scourge that is HIV. But before I take that short break, I hear you're talking to us on that hashtag new normal, even as we asked you why you think the youth are more afraid of getting pregnant than contracting HIV. Rogers Okungu says there is a lot of emphasis on early pregnancy, so young girls go for the contraceptives to prevent pregnancy since they are told that ARVs are easily found. Valid point. Paul says bringing up a child is more expensive than getting ARVs, and there are no jobs to sustain children's needs. Interesting perspective, but remember we talked about it being a double-edged sword. Karenju Kamau says they believe no pills to avoid responsibility. AIDS has pills to suppress the virus. Interesting perspective. Rude says they are concerned with immediate problems, not long-term. Yes, short-sightedness is why we are seeing an increase of new infections amongst that age group. We have Rico says you can't hide a pregnancy. That is true, but here's the thing. You also can't hide HIV for too long, especially from yourself. The effects are also as dire. Now, Stephen Mokuna says at least HIV is a secret. Well, it can only be a secret for so long. Idris Rasta says pregnancy is easy to notice than HIV, which is internal, and no one can easily notice that. C.L. Walker says pregnancy is evidence of sex which is still taboo for the unmarried. It has more weight on our social setup than HIV. Interesting perspective there, because each carry a responsibility. We'll be back with more on Your World. Stay with us.
Heaviness and a burning inside, it could be heartburn.
Indigestion and heartburn? Eno gets to work in 6 seconds and works on the 6 symptoms of heartburn so you can keep living life non-stop. Eno, fight heartburn and indigestion fast.
The leasing of state-owned sugar mills.
Those mills have been bottomless pits, government sinking in money there and nobody benefiting.
A dig into the due diligence conducted.
Who has valued the assets of these 5 state sugar farms to predicate this leasing exercise?
The burden being borne by the taxpayer.
We are writing off 62 billion taxpayers' money.
And the alternatives which were shelved for the leasing exercise.
Shouldn't we have taken this through the privatization commission as some have actually asked?
This Tuesday, Business Redefined speaks to Agriculture Cabinet Secretary Peter Munya on the issue of leasing state-owned sugar mills.
As a fitness fanatic, the closure of gyms due to the coronavirus pandemic has hit me really hard. But as we know, the virus spreads quickly in enclosed areas. So for now, working out from home has become my new normal.
Since COVID-19, a lot of residents are staying away from the market. The solution, door-to-door delivery of groceries and cooked meals.
Did you know there's a laundry bar soap that can help save you time, water, and money? You save by not having to use multiple products. And you only rinse once. For a laundry soap that can help save you time, water, and money, try Whitewash Extra. Brand power, helping you buy better.
Are you a business owner? Sign up today to accept fast, easy and secure payments through Visa. What's more, enjoy flexible financing options for your business. Call us today on 0703 095 445.
It is your world. My name is Gladys Gachanja. Let's take a look at the other world. Now, the humble manhole cover might not seem like much of a blank canvas, but one Japanese city is reimagining the possibilities with illuminated versions featuring animal characters. Tokorozawa, near Tokyo, is hoping the unusual additions will attract visitors, including enthusiasts of the art. Elsewhere, Israeli sun sculptor Tivai Halevi builds replicas of the UAE's most distinctive and famous buildings with sand, including Burj Al Arab and the Sheikh Zayed Mosque at Tel Aviv's Guela Beach. The event is an initiative of the Tel Aviv municipality as a tribute to the forthcoming peace agreement and the establishment of diplomatic ties between Israel and the UAE. Halevi said, and this I quote, "In this project we created the skyline of Dubai as a gesture to the agreement with the UAE, and I'm very happy with it because I love Dubai, I love the buildings there and their architecture in general. The Tel Aviv municipality asked me to make this project and I made it with great love." In Turkey, the schools there prepare for the start of the academic year with new measures aiming at limiting the spread of the novel coronavirus. As daily coronavirus cases remain above 1,000, schools will reopen with distance learning on August 31st, and then a gradual return to classrooms is expected from September 21st.
Maskelere atılan çöp kutuları farklılıkları ayrı ayrı. TRT kökenli.
Now, Lulu is a fashion designer's dream model and mousse, happy to spend hour upon hour being measured and dressed and posing in tailored couture outfits and artistic designs. Lulu is also a cat. Her doting owner, Woon Ching Kiao, makes a living from designing miniature versions of traditional flowing Chinese gowns known as hanfu for cats and dogs that sell for up to 7,000 shillings. After quitting her job as a copy editor last year, the 26-year-old works from her apartment in the central city of Changsha, designing pet-sized dresses out of pastel colored chiffon and decorated with embroidery, beads, frills, and motifs that she sells online. Creativity at its best. Now, portrait of Virginie Grossat, a plus-size fashion influencer with tens of thousands of online fans, was displayed, and she said what her really advice is to dare, says the 32-year-old, who inspires with her pin-up outfits, impertinent poses, and free speech. Virginie says, "We often see the plump woman very jovial, very smiling, both in the media and on TV shows. But when you look at the fashion, the girls on the catwalks, etc., they make a face. They look serious, sometimes even haughty. I don't see why I can't look like that, so I try to embody fashion to really be a reflection of what you see on the catwalk or in inspiration. So I'm sulking in my pictures." Now back to our conversation of the day, living positively with HIV. Now, before we went to break, Reverend Canon Chris Kinyanjui, who is the General Secretary of the NCCK, mentioned the role of the men in the fight against HIV. Nelson, has this helped involving the men in the fight? Nelson?
Yeah, I hear you. Thank you very much for that. And I agree that it has been a big problem to get men to come forward and to do the testing. And from statistics, we know it is men who are dying. I think the challenge emanated from the fact that this was from initial stages a feminized epidemic. And if you look at our facilities, if you go, even as a man, if you go with your child, you'll be asked, where is the mother? And if you go to a facility, you are likely to meet a nurse or a counselor who is a female. unless you go inside, that's when you see men. So I think traditionally, hospitals, health facilities have been associated with women and girls and ANC and pregnancy and children. So this was a little bit an obstacle. But I agree that there have been efforts to sensitize men and to bring them forward and to make sure that they come forward. Some of the examples are provided there by the bishop. I'm also aware NASCOP is working with the men and clinics to do male engagement and also to have hours that are friendly to men, and there are a number of strategies put forward. So I want to agree that all these efforts are welcome, and the most important one is that men need to be educated on their vulnerability and their responsibility also in terms of making sure that they stay healthy and they don't continue to transmit the virus.
Okay, now latest data has shown that there are more women living with HIV and more men succumbing to the same, which also points to the increase of the mother-to-child transmission. Talk about that, Daktari, and why we are seeing an increase of the same.
Thank you for your question. Now, as a CEO of Nelson has put it, men, even in the health-seeking behavior of men, is they don't really tend to come to the health facilities. That is one. And so we have the women. And you know, because when a mother is pregnant or she's breastfeeding, she'll religiously come for the antenatal care clinic. And one of the tests to be done is HIV testing. And so realizing that, and most of them are not accompanied by their partners. And I think that is why the government, through the Ministry of Health, was able to utilize now the self-test kits. So when a mother comes and they're tested, then if the partner did not accompany them, then they can have the self-test kits for the partner to be tested at home. So what we realize is even in identification, I think in the first, we have the 390s set up the targets by the UNAIDS some time back. The first 90, identification, linking to care and the virus suppression for the ones who are on treatment. We noticed that we have around only 79% of our men know the HIV status. So we have a gap of 21% in comparison to women who we have around only 16%, 15% who do not know their status. So around 85% know, and it's because of that health-seeking, behavior, and so it limits. So when it comes to mothers who are pregnant or who are breastfeeding, if a mother comes to the health facility and they're tested and they found they're HIV negative, however, their partner did not accompany them, so their HIV status is not known, then they go home and still, business will continue at home. That's where we have one infecting two, that if the man is HIV positive, he will infect the pregnant lady or the breastfeeding lady, and even with the child. And so we urge the men to know their status, but most of them use, like, if the lady goes to the health facility and they find their status, like, so what were you told? Negative. So even me, I'm negative. That's what they usually assume, which is not so. And that's why we are a mother who was negative, diagnosed negative, for example, in the first trimester or even second trimester, you find that trimester or during delivery or when breastfeeding or when they come now for the postnatal care, they are diagnosed, they are positive, and they wonder, but I came earlier. And in fact, to me, that's where I was drawn to the world of HIV. When in the facility I was working when I was a bit, early in the years of after my medical school, that you realize mothers, they religiously will come to the antenatal care. But then when it comes to postnatal, you realize the children are having, pneumonia now and then, diarrhea, those opportunistic infections. So I would ask the mother, could you help me with your card of the antenatal care? And they're like, yes. You give the card, it states there that they are HIV negative, that they were diagnosed that time. But the partner did not come to the facility. So what happened is, in between there during labor, during delivery or during postnatal is where they got infected. And we think, like, for example, what the Canon they're doing, that urging the men, talking to them, those initiatives are really going to complement what we are doing in the country to ensure that we have men join in the fight and we achieve the last mile that we are there, because we are almost achieving the set targets of the 1990.
Okay,
Yes.
and we also touched on the fact that there seems to be an increase of mother-to-child
Yes.
infection, and yet this is something that we had suppressed as a country. Why?
I know. In around 2016, we were around at 8.5% of mother-child transmission rate in the country. However, several factors contributed to it. For example, 2017, we had a lot of strikes, and nurses went to strike. And that one, however, we saw it like it was 1 week or 1 month, it affected. Because now you see mothers were not coming to the health facility, so they will not be tested. Some would not even come to deliver in the health facility, or even in postnatal, they would not be offered that chance. That was one of the factors. But as well, it has been a fight for, to reduce the mother-child transmission of HIV. But when, the government realized that through the Ministry of Health, and we thank the Cabinet Secretary and the Principal Secretary, that in 2018, we were around 12.4%. Right now, we are around 11.4%. So we are doing well. That is before, the COVID-19 came.
Yes.
So right now, we're a bit worried because we have noted number of teenage pregnancies. That means that they never, it was unprotected sex. So we're a bit worried that by the time we are hitting December there and January, when, we look at the data of the new infections, and as Canon said that in 2002, we used to have 106,000 new infections per year. Now we're at around, 36,000. So this year we do not know. We hope that we'll not, reverse the gains that we have done over the years. Yes.
And speaking of gains, a man who was dubbed the London patient has been cured of HIV. Now identified as Adam Castillejo, doctors have found no trace of infection nearly 30 months after he stopped taking his antiretroviral medication, and he becomes the second person to be cured in the world after stem cell transplant treatment.
Our colleagues at UNAIDS say they are greatly encouraged by the news that an HIV-positive man has been functionally cured of HIV. The results reported at a conference in Seattle is one of only 2 cases of reported functional cures for HIV. The man treated in London's for Hodgkin's lymphoma using stem cell transplant from a donor carrying a rare genetic mutation. The virus has been undetectable since he stopped taking antiretroviral medicines 18 months ago. Executive Director of UNAIDS said the breakthrough gives us great hope for the future, but also shows how far we are from the point of ending AIDS with science, as well as the absolute importance to continue to focus on HIV prevention and treatment efforts.
Now, Doreen, even as we bring this conversation to a close, when you see such a story, curing of HIV, does it trigger hope, and do you think this might one day be the reality for Kenyans?
It definitely does trigger hope and show that even though we are a little bit not near getting the cure, but definitely one day we're going to have a cure. And along the years, HIV has changed. HIV is not how it used to be back then when it was definitely a death sentence. Now people can live. I've lived with it for 28 years. Someone else has lived with it for over 30 years. So there is hope that one day this is going to be our reality. But until then, let's continue taking our airways.
Okay, and Victor, you're a guy, you're young. Your message for those that are young?
Well, you're young, and being a young person, you're allowed to quit and start, quit and start. Don't limit yourself, love yourself, and take care of yourself.
Okay, and for those that are living with this condition?
If you're living with HIV, HIV is not a death sentence. It's never a death sentence. And if someone dies, person living with HIV, they die of opportunistic infections, not of HIV. HIV has never killed anyone. So love yourself, and if you don't have a support system, seek a support system. And if you don't have any support system available, I'm available. You can reach me, and I'll be a support system.
Okay, well said. Now, Reverend Canon, you have been standing in the gap in ensuring that you help the other stakeholders fight this scourge. Your parting shot.
Thank you, Gladys. My parting shot is a message to the men. I am a man also, and I have taken the HIV test several times. And it's just like the test that we are taking for COVID. Some of us require a lot of prayers, a lot of fasting, and a lot of, encouraging ourselves to go and take the test. Please, I encourage all the men to take an HIV test and know their status. And once they know their status, I want to share their results with their partner. If they can test with their partner, that would be the best shot. And thirdly, once you know that you are positive, please take your medicine faithfully, and you shall live a long time. As you have heard from the past people who are living with HIV/AIDS, HIV/AIDS has never killed anyone. It is the opportunistic diseases. So take your medicine, and we'll pray for you and support you.
Very well said. Okay, and Nelson, you have been in the walk with those that are living with HIV. What is your word of encouragement?
Thank you very much. I think in the wake of COVID, this is the time to tell people to go and know their status so that HIV does not become your underlying condition. For those who know their status, it is time to religiously adhere to your treatment so that your immunity is strong, your body is strong. So we try very much not to be exposed to COVID, but in the event you are exposed to COVID, then you can manage. My last message on this is that HIV is not yet done. We are not yet done. So to do much to end HIV, we must ensure continuity of care. We need to test people. We need to make sure those who are tested positive stay on treatment, and it is lifelong treatment.
Okay, and Dr. definitely NASCOP, working on behalf of the Ministry of Health, has been fighting this scourge way back, since 1984.
Yes.
We've made great strides. What else needs to be done to ensure that we hit the target by 2030?
Collective effort, definitely, of all stakeholders, as we have not yet, achieved, and you have not done, achieved the 95% of the 3 areas, testing, linking to care, and the last one. And urging as well, like the other different, stakeholders, the county government, the civil society, people living with HIV, and other, donors and developing partners, that still there is work to be done. And for all of us together, if we put our heads together and be able to work as one, we can be able to achieve. But still on the same note is, appreciating the government and the supporters, like now when the donors are, most of them, the funds are dwindling, For example, we thank our president. Last year he was able to commit $6 million for the government of Kenya to the Global Fund, and as well thanking the commitment of our cabinet secretary, the Honorable Mutahi, and as well our principal secretary, Madam Ochache. They are really committed to ensure that every shilling that we have, we use it for the right use, but at the same time bringing in all the partners on the table so as we can be able to maximize and optimize that we have. But as well appreciating the communities, they have really walked the talk. They have been with us, and they have been able to bring the clients who are positive and even to talk to the ones who are negative, so as we can be able to achieve. Yes, we agree we still have a long way to go. For example, we have adolescents, young persons. We have to prevent mother-to-child transmission of HIV. At the same time, we have, to achieve the viral load suppression of the children. But we can be able to do this.
Very well
Thank
said.
you so much.
Thank you all who joined us on this conversation. Dr. Catherine Ngugi, who is the head of NASCOP, Nelson Otoma, CEO, NEFEC, Doreen Moramo Chacha, who is a HIV advocate, Victor Kariuki, also a HIV advocate. Earlier on, we were joined all the way from Uganda by Gonzaga Sentongo, who is a volunteer who actually is part of an NGO that collects and delivers ARVs to those that are living with HIV, and of course Reverend Canon Chris Kinyanjui, who is the General Secretary at the NCCK. Thank you to all. Now, before I bid you farewell, I understand you're still engaging us on that hashtag new normal, even as we understand why the youth are more afraid of getting pregnant than contracting HIV. Diego Kipkoet says ARVs are given for free, but raising a child is costly. That is true. Alexander Mushugia says, I guess pregnancy has a great stigma and can't be hidden like HIV. Josephine Mutungi says pregnancy needs more commitment with a lot of responsibilities, but HIV is a maintenance thing. Simon Manjero says inadequate information on HIV/AIDS among the youth makes them weigh it as a better option. For pregnancy, they strongly fear societal stigmatization that comes along with it. This is true. It has been talked about even as we continue with this conversation. Blaine says, great sentiments. Let's encourage our communities to live positively. We can support them by eradicating stigma against them. Ambrose Awiti says, Vijana want to blame everything on the older generation, even things they learn. Well, I hear you, and yes, great personal responsibility needs to be taken up even as we fight the scourge that is HIV. Well, according to the World Health Organization, wellness is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So tomorrow on Your World, we focus on wellness and also understand the practice of yoga, which is also advised to take up even as you invest in your wellness. And we will do this as we continue to cater for a healthier you. See you then. My name is Gladys Gachanja. Have a wonderful week.